Hello, my name is Dajai Livingston and I'm a Certified Nurse Midwife. I'm sure all of you are excited to meet your little bundles of joy and excited to experience labor. But where do we start? How do you know exactly when it's real labor versus Braxton Hicks contractions? So usually I tell people contractions are something that you can time. So some people describe them as cramping in your lower abdomen. Some people may experience it in their lower back. But the real big difference between false labor and real labor is, are they strong? Does anything make them better or worse? If you notice that you spent the day working outside or doing a lot of things around the house and you haven't really drank much water, more than likely those are probably some Braxton Hicks contractions. So in order to make sure it's Braxton Hicks versus early labor or regular contractions, I would recommend that you drink some water, have a seat or lay down and see if those contractions get better for you. If it's something that's coming more regularly, so if they're at least 5 minutes apart and it's consistently like that for 2 hours, then we might be onto something. So what I want you to think about doing is when you start to feel contractions, grab your phone or grab a timer to be able to sit there and time how often those contractions are happening. There's a lot of apps out there that you can download on your phones. One of them is a contraction monitor, because sometimes it may be difficult to time when you're having a contraction and when it's over, and sometimes it can start to become a little overwhelming thinking about keeping track of that, so the apps are very helpful. You are going to time your contractions by starting when the contractions start, and at the start of the next contraction, that tells you how far apart they are. So if you got a contraction at 10 o'clock and the next contraction started at 10:05, then that means that contraction was 5 minutes apart. So we want them to consistently be 5 minutes apart. But usually once you have an application that tracks your contraction pattern, it will tell you how often they are and also how long they're lasting. Usually you want the real contractions to be between 60 seconds to 90 seconds. I know that sounds like a long time, a minute and a half, but you can do anything for a minute or a minute and a half. What can you do for early labor? So early labor is usually when the contractions start. You're feeling contractions more regularly and you want to stay at home for a little bit just to see if it's actually going to kick in. So for some people that may be having contractions every 5 to 10 minutes for a couple hours. Some things that you can do at home for early labor would be relaxing. You can take a warm shower or a warm bath. A heating pad sometimes is helpful to use on the lower back. And there's lots of different positioning that you can try at home for comfort, including being on your hands and knees or like laying on your side with a pillow propped in between your legs. Walking is actually very good for early labor and to kind of get things going. So being up and active, moving and doing different positions can all help to get the labor going and also to get baby in a good position to facilitate labor. A great resource that I would recommend for early labor and labor facilitation techniques would be spinningbabies.com. They have great pictures and great resources for patients to use when they're in early labor. For some patients, when they start having contractions, it may be in their abdomen or the lower part of their stomach. But for other patients, they may notice that they're having this consistent lower back pain. So if it's a back pain that's coming and going, we would recommend that you track those contractions and see, or track that pain to see if it's a consistent pattern. If it's something that's regularly happening where you're constantly getting a back pain every 5 minutes and it starts and then it stops, more than likely that can be back labor. Back labor sometimes happens when the baby's position is where their head is or the face is facing up to the ceiling, what we call sunny side up. It's okay if labor starts off that way. It can sometimes be a little bit more painful to have that back labor versus in your lower abdomen. Some things you can do to help to assist that would be getting on your hands and knees or on all fours, and sometimes that can alleviate some of that pain in your back. But I always tell people, if taking some Tylenol or using a heating pad and drinking water does not improve that, then you need to come into the hospital to be assessed for labor. So some warning signs that you want to be mindful of when you're at home. If at any point your water breaks or you're having this leaking of fluid, you want to call your doctor, and you will be coming into OB triage to be assessed for that, because we will want to make sure that your water isn't broken. And if it is, then that's something that we will want to admit you to the hospital for. You want to pay attention to the color of that amniotic fluid or the color of the leaking that you're having. Also know if your baby's moving. Your baby should be moving even during early labor. So if you notice that the baby's movements have decreased or you're not really feeling any movement, you want to drink some juice, sit down, eat something, and see if you're getting at least 4 movements in an hour. If you're not getting that, you should be coming into the hospital. Other things, if you have any vaginal bleeding, you definitely want to come to the hospital for those signs. Sometimes people have a bit of bloody show in the early labor, which is like a mucus and blood mixture, which happens when your cervix starts to change. But if you're having bright red bleeding or you're noticing more blood like in your underwear or running down your leg, then you definitely want to be seen immediately for that. Active labor is when we consider the contractions to be every 2 to 3 minutes. So we want the contractions to be that close together when it's time for you to get ready to have a baby. So usually they start off further apart, and as labor continues to progress, they'll constantly get closer together. So it may start off as every 10 minutes, and then it moves to every 5, and then it may be every 3 to 4, and then 2 to 3 minutes. There are some patients that have different labor patterns, and sometimes people may only have been contracting every 5 to 7 minutes, but their cervix is dilated to 6 centimeters. So everybody's labor pattern is different, and ultimately I tell people, if you ever have a question or concern about if this is truly labor or what these contractions are, concerns about your baby or yourself, to always contact your provider, whether it's your midwife or your OBGYN.